people want to get more efficient, regardless of how many staff they have, but it makes it even more difficult or even more attractive because of the difficulties that have arisen really around COVID and post-COVID. It's just hard to staff. It's hard to staff the revenue cycle. It's hard to staff the patient access, which is a little bit more, it's not as specialized. You don't need a lot of skill necessarily on the patient access side, but the middle revenue cycle and the back end revenue cycle especially, those are just very difficult because you do need a little more certifications when it comes to those areas. So automation is very attractive in those spaces. And the way that we see it playing out is whether people are turning to just traditional automation services or robotic process automation or machine learning or large language models. Most of that is being used to streamline non-patient facing processes. And the patient facing processes, the processes where, especially at patient access, and especially when you're talking to someone about getting their bill paid, those are the more simple, repeatable processes are the ones that people are turning to for automation. In the middle revenue cycle, where there's not a lot of patients who are involved, it's still focusing on really the simple things, the simple repeatable things, and then those coders who are and the folks who are working on clinical documentation improvement, those folks are focused on really the higher level, more complex challenges that they see in those spaces.
Certainly, certainly. And that would certainly apply to prior authorizations as well, because we see that
Mhm.
definitely still remains a main pain point for many